I just wanted to understand.
Yeah, this is where I was sitting, right next to
It's
Shauna.
it's administrative.
Yeah, I was right
That
next to
10 million or
Shauna.
11 million dollars a year in that you're out for the software itself.
And he goes, and he goes, no,
Well, it depends on how that is charged. I'm
man.
starting to
Glad to be here with
quite
you.
a bit less. What we did is we said,
Yes, we can hear you.
or something like that.
Okay.
He's hopefully very good.
And the stuff that I've done with eligibility, it's been
Vicky.
Okay.
So that's why we just
Does it include bodies? Does it include staffing to do eligibility work?
What agency?
At the state? Because I can't figure out why the state is,
Consumer advisory.
that's the state.
Why are transferring isn't just for IT, it's for all the stuff to the state that what we do for the exchange.
Interesting.
There'll be appeals and there'll be other stuff.
So have you guys talked about that?
Okay, well,
I mean, to me, that's a state.
I'll let everybody else pick theirs first. I just sucked
Why-
out soda, so I'm good for a little.
It's,
Eligibility for Medicaid isn't the
it's
state
not
expense?
just for Medicaid. The eligibility engine is for Medicaid and exchange.
I see.
So it may be 50-50 or 33-67, something like
Okay,
that.
based on the look back of who becomes eligible.
Right, which we don't have yet.
Yeah, yeah, okay, so again, it's one of these,
Yeah.
okay. And so then what's the 13 million in consulting fees?
So, yeah, it's
That
not
also
just
seems-
consulting. So there's several things. So,
Yeah, that's what it's called.
and there's a couple things that may end up going away as well. So we have marketing and advertising there that we're like.
I don't know where you want to be.
Probably overestimated that.
Yeah.
We're looking at.
That's a good place to be, by the way, I'm not complaining
Yeah.
about
The
that.
insurance and risk adjustment, we're looking at $500,000 a year for that.
Like the beacon on their
So
screen.
that might go
Easter
away
egg,
as well.
Okay.
Egg doors.
There is just
So
big
why-
consulting.
why-
There's also the business operations solution. So I expect that to get quite a bit.
Okay.
Because not only will there be software,
got through, I
but
just
call
talked to
center staff
Elizabeth.
assigned to the call center, and there'll also be notices
Where?
that have to be
Yeah,
sent out.
Maryland.
Some
Right.
mailings, stuff like
So
that.
it seems like reinsurance would be a cost of the insurers that are on the
And
exchange.
that might end up going to DOI or might go to the feds altogether.
Because those, yeah, I was gonna say, because wherever it is, reinsurance is part of doing cost as a pay, right?
Right, we wanted to put it in there to begin with,
Okay.
just so that it was accounted for. Once we figure it out, I was going to back it out.
Okay.
I didn't want to not put it in there.
Yeah, yeah, and then be looking for the money.
Raise it.
Yeah,
Right.
okay. So you've got a
hoping-
bunch of numbers in there that potentially could be significantly less.
Yes,
Okay.
I'm really hoping that it is.
Because I looked at those, I'm like,
But what I will say though is, well, and I don't know what the web portal is going to be. That could be significant. We're doing the process right now and going to select a vendor, so that we don't know where that's going to fall. Most exchanges right now are operating at $10-12 minimum per month, and these are only $7.50. So we're really cheap right now.
and they're up? I mean, these are ones that are operating, or those are their estimates?
No, our choice is offering $10,000 lives, $12 minimum per month. So.
Huh. Is that variable cost? That, I mean, is that just because it's only 100,000 and so we've got, I'm sorry, fixed costs spread over small populations?
How are you? Good. CJ Bogey.
Right, but I guess what I'm saying is, I get
Where's
that
ice
piece,
cream?
but what I'm saying is there a bunch of fixed costs there that are only spread over 100,000 lives, whereas if you had a.
You're
level
expecting far too much
system
service.
that's
This
over
is
maybe
state
200,
agency.
300,000
Oh, that's right, I
lives,
forgot. That's where I
$1
came from
amount
now.
of PMPM
Hello.
would decrease
Yeah, the
substantially.
better our enrollment is, and that's why you see the curve in all those charts.
Okay. Anyway,
Scott? How you
okay,
doing?
I appreciate
No problem.
your catching me up.
So what is our seating?
Just, you're in the chair today.
Sign
Chair
in.
today. Can you run this for me?
You don't know my name?
No, I'm serious. Yeah, so the vice chair indicated a couple weeks ago she wouldn't make it, the chair said she's, yesterday she's sick. Okay. So have a seat.
Okay.
I'll help you. Okay.
Co-chair.
Sure. Are we going to have a quorum? Cross fingers. We only need 4, and apparently it's. That's it. Apparently only until 2:30, so we'll knock this out quickly.
Well, one of them is in 5 different chapters. The second one is just one advertising for by
Did it make sense? Did it make sense?
Yeah, I think so.
Okay, good.
Frankly, there's nothing to add.
That's the first start, so it makes sense.
It's a good test.
But apparently the model said Number 6, working on professional shall adopt regulations. There's no models here.
You know what, though, let's move a little bit closer. Let's pull these two tables out. Just move closer. Yeah, I think this will make a little more sense to be closer to it, closer to the phone. You wanna? Are you in charge of this? Is this the remote?
My granddaughter's nice birthday, folks. Good time. Goes by too fast.
Do we have anybody on the phone?
Hi, this is Chris Knoyer.
Hi, how are you? Anybody else?
How are you?
Is Renee on there?
John, this is Mike Torvinen.
Hi, Mike. Who just joined us? Did somebody just join us? Could they identify themselves, please? All right, so we're still waiting for a quorum. Hey, Mike, can you speak up? I'd like to see if they can hear you in the south. Is that Eric down there?
Yes.
Yeah, it's me.
John, this is Mike. When I logged in, there said there was 4 participants, including myself. So.
Okay. And Eric, could you hear Mike talk on the phone?
I did. I could.
Good. And Mike, can you talk? Can you hear Eric?
Sure can.
Great.
So who else is on the phone?
So I heard Christina. We have Scott here, and we have Eric down south. Is Kevin or Renee on the phone? Who just joined us?
Renee Niehaus.
Renee, good to hear you. All right, so we have 4 people. So the vice chair had something else going on, and the chair is sick today. So I've asked Mr. Dickinson to chair the meeting for us. So if you'd like, I'll do the roll call.
Yes, thank you.
All right, so Ms. Cornier,
Present.
Mr. Dickinson,
Present.
Mr. Lloyd, Ms. Niehaus,
Here.
Mr. Walters.
Here.
Oh, we got 5. Excellent. And the chair and vice chair are absent today. So,
Okay, so we move on to item 2.
yes, please.
Any public comment?
Is there any public comment in the south?
It doesn't appear there is any south, John. Unless, I'm sorry, did you want to?
Is there any subject to that public comment?
Apparently not right now, John.
Any public comment in the north? Anybody on the phone?
Okay, no public comment, so we'll move on to approval of the minutes. Hopefully everybody's had a chance to review the minutes of last meeting. Can I ask for any comments or a motion to approve?
For the record, Eric Lloyd, I still move.
Can I have a second?
This is Renee, second.
All in favor, say aye.
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 Opposed?
Any opposed? Hearing none, the minutes are approved. Okay, so moving on to item number 4, and I believe this is your agenda item, John?
It is, correct.
Okay.
All right, so the status of the work completed related to the Finance and Sustainability Advisory Committee. I'm going to move through this relatively quickly. It's just an update. You can see the committee calendar, and there was one item, the discussion about well, 2 things. First of all, the referrals to the Medicare Coordinator Services. That was deferred for further review. There was some concern among the broker community about referring individuals to a Medicare coordinator service. Because there is no Medicare coordinator service in the state of Nevada, we'd be deferring those potential commissions to an organization outside of the state. So we're going to bring that back at the next meeting and review that one. Additionally, the sustainability options, you'll notice agenda item number 5 provides data on, or as much data as we could come up with, on the different options for providing the main source of funding for the exchange. That one, the board had extensive discussion on last Thursday, very similar to the discussion that this committee had about whether or not to approve a philosophy on how you wanted to go forward or whether or not you wanted an actual funding option. They've asked that the committee take another look at that, so that's the majority of what we're going to do today. Regulations haven't changed, amazingly. They haven't changed in the last month, so the same information from before. The committee recommendations approved by the board are the same recommendations that we had the last meeting that were approved, so nothing has changed there. On the May 10th meeting, so last Thursday, the board approved the committee's recommendation to charge user fees for standalone dental products, charge user fees for standalone vision products, and offer advertising on the web portal if that makes sense. As far as the web portal, we can set up good standards for that advertising. So with that, I'll be happy to take any questions on agenda item number 4.
So this says for possible action. Is there?
There's no action necessary.
Okay. Hearing no questions, we'll move on to agenda item 5, which is discussion and possible action regarding the following primary care or primary financing options for the exchange. General fund assessment per member per month, or percent of premium fees assessed on enrollment in the following major categories, or other potential fees. So, John, I'll turn it over to you.
Sure. So as I indicated, the board asked the committee to take another look at this. Couple disclaimers on this item. First of all, the enrollment and budget assumptions. We're still working on fine-tuning the enrollment assumptions. I think we talked about it at the previous meeting, but we have uptake estimates from the Congressional Budget Office of somewhere around 20 to 30%. We have uptake estimates from the Office of the Actuary with CMS of 77%. That creates a very large swing in the enrollment, or the potential enrollment, and it makes it difficult to determine what our enrollment will be, and then therefore be difficult to determine what our rates should be that we charge. So we're working on finding a middle ground for that, and we'll provide that as we get that. It may not actually come back to this committee. It might go straight to the board when we get it. Likely it will go at the August board meeting with our budget, with the final budget. The other items are the expenses. I just had an actual discussion right before the meeting about the expenses. As we indicated in previous meetings, they are, I would call them soft numbers. They are placeholders in a lot of cases. We don't have contracts set up yet with some of the vendors, and those contracts will determine what those amounts are, but we wanted to put something in there so we had a good starting point. We tried to estimate slightly higher so that we could decrease it. It's usually better when you overestimate and can pull back a little bit than it would be if we underestimate and say, oh, we didn't mean $7, we meant $10. So keep that in mind, but we're going forward with the best information that we have at this point. The other item is the Affordable Care Act funding in 2014. I think we discussed this at the last meeting as well. It appears more and more likely that we will not receive any maintenance and operating funding for operation of the exchange in 2014. If there are any updates to the web portal or design, or any updates to our policies or changes, then we can expense those costs to the Affordable Care Act and the federal government. However, strict maintenance and operating will not be paid for by the feds, it appears. So in options A through E, or at least A through D, we've provided 2 different scenarios for each one. So I think we should need to focus on the second of each one, which is the rates without 2014 M&O expenses. That means it's a little bit higher cost than what we had anticipated. We will try to structure our contracts, keeping that in mind with our vendors. But at this point, again, we don't have any contracts yet, so this is the best information that we have at the current moment. So item number A is to fund the exchange through an assessment on enrollment with the exchange. This is basically only a fee charged to either carriers or consumers for the enrollment that's in the exchange. It does not include any enrollment outside of the exchange. For this item, we believe that the board has the statutory authority to charge the fees to enrollment in the exchange, and we're pretty comfortable in saying that the board does not have the authority to charge any fees outside of the exchange. So that makes item number A pretty appealing. And before I go any further, is our Deputy Attorney General down south?
No, not here.
Okay. All right. We'll continue on and see what happens. Okay, give me just about 1 minute.
Actually, wait till we have our attorneys.
Well, we've gone this far, so let's keep going. All right, so anyways, so obviously a concern is the uptake rates, which we talked about, the estimates. If you look on page 4 and 5, well, we'll look at page 5 since that's the one without maintenance and operating. We can see what the rate to cover cost is. That rate does not build any type of reserve. We need to have some operating cash so that we can actually pay our bills on time. And so the goal was to create an operating reserve of about 30 days. So you see that we charge a rate that's slightly higher. The rate to cover costs as we have them currently in our budget is $9.88 the first year. And if we charge $10.50, that would generate about $500,000 in reserves that first year. And you can see how the reserve goes up. So the second year, if we charge $8.59, that covers our costs. It doesn't build a reserve. If we charge $9 per member per month, that adds an additional $600,000. So you can see that our total cash reserve at that point is $1.2 million, and it's right at the 28-day mark. So what we've tried to do is create a nice gentle slope to the rate that we charge. You'll see in some of the later pages how the rate to cover cost fluctuates a bit. And these ones actually, so that the green line or the line with the circle is the one that we would charge, and it's a nice gentle slope in each of these options. So you can see on page 5, the enrollment estimate is currently $102,000. You can see our rates to cover the cost and to build operational reserves. The funds that are generated from the enrollment fees are $12.8 million. The supplemental revenues of about $300,000 gives us our total revenues and then the reserve. And you can see how that goes forward to 2018. Again, a lot of estimates in this. Certainly as we get out toward 2018, these numbers get really fuzzy. Also, there's no inflation included in this, but we wanted to have sort of a kind of a long distance look at where we're going. And keep in mind that we build our budgets on a 2-year basis. This is quite a bit further out than we typically do, but again, we wanted to have that long-term look to see where we would end up in the end. If the committee chooses to go with option A, to fund the exchange through an assessment on enrollment within the exchange, then you... Did you get a hold of them? Okay, great. Okay. Then you would need to determine whether or not that fee would be charged to carriers or if the fee would be charged to consumers. There has been concern about the medical loss ratio. However, recent guidance indicates that a fee charged by the exchange would not be considered in the medical loss ratio calculation to meet the 80 or 85%. I guess it's 80% for the individual small group markets. So, so any fee that we charge will not affect that ratio and will still allow the insurers to meet that, assuming that everything else they've done is correct. Another concern was whether or not the fee should be taxed or could be taxed. Carriers argue that since the fee is charged by the state, it should not be taxed. To mitigate this, a bill draft request could be submitted with the language similar to that of NRS 690C110, such as the tax imposed pursuant to NRS 680B027 does not apply to any business transacted pursuant to the provisions of this chapter. We'll need to work with the DOI to make sure that that makes sense, but it's a starting point. Or you say the fee is charged to consumers. The biggest problem that we have with that is if it's charged to consumers, number one, it wouldn't be subsidized by the federal government. So we're losing out on money coming into the state. And additionally, we would have to create an administrative structure to bill 100,000 plus individuals and all the staffing requirements with that. I will say that our budget, as presented in the expenses, does not include extra staff and administrative costs for that piece of it. Item B was to fund the exchange through an assessment on qualified health plans. So a qualified, to be in the exchange, a plan has to be considered a qualified health plan. If it's a qualified health plan, it has to be offered both inside and outside the exchange. So there will be a portion of enrollment that is on a qualified health plan that's not in the exchange. Keep in mind that a qualified health plan has to have the same rates and benefit structure inside and outside the exchange. So even if you charge inside the exchange, the entire enrollment for the entire group is absorbing that cost. So then the legal issue with that is that we may not have the statutory authority to create a regulation to charge the entire qualified health plan market. In our estimates, we assume that 75% of the small group plans will continue to be offered as non-qualified health plans in 2014 and 15. In 2016, when the market merges, we assume that it'll increase to 50%, and then increases 10% per year after that, till 90% of the small group market is inside the exchange. With that, and the reason that we did that, just a rough guess, but on the individual side, I think there's a little more churn, and it's likely that you'll probably go to the exchange to get your coverage if you're on a qualified health plan, or you won't be on a qualified health plan at all. And then on the small group side, employers will probably continue with their current plan for a little while and then gradually gravitate toward the qualified health plan, we expect. We'll see if that's true or not over the few years, but on page 8 you can see figure 8, which is figure 7 and 8. This chart is similar to the previous one, although you can see the rate itself is lower because we're charging it to a larger group. So you can see the comparison of exchange enrollment to non-exchange qualified health plan enrollment, what our assumptions are. And then, so you have the rate to cover costs, the rate to build operating reserves, and then the second blue line is the non-exchange qualified health plan enrollment fees. So that kind of gives you an idea of how much funding is coming from outside the exchange in this case. So that lower rate, while it is a benefit because it is over a larger market and it's a lower rate, you can see that $5.5 million estimated dollars are coming from enrollment that's not inside the exchange. Item number C is to fund the exchange through an assessment on the entire major medical, fully insured individual and small group market. Same idea as before, same legal issues, larger pool of individuals, and so you can see again the non-exchange enrollment and the much lower rate to cover costs, and then the amount of funds that are coming from enrollment outside of the exchange. And that's on figure 11 and 12 on page 11. Then item number D is to partially fund the exchange through a general fund assessment. This would obviously take legislative action in the budgetary process. But basically, if we insure approximately 96,000 people that don't currently have coverage. Now you'll notice on the previous pages the enrollment figures were 102,000. So we're guessing in that first year we get some low amount of enrollment from currently covered individuals and from employers. But basically you can see the increase in the number of currently uninsured that would get insurance through the exchange. Based on that, each of those people will be paying a premium tax. They're not currently paying a premium tax, so that will generate extra general fund dollars. So we used the 2010 data as a starting point based on the mix of domestically domiciled organizations and organizations that are domiciled outside of the state of Nevada, and assuming 0% inflation since 2010, which is unrealistic, but we wanted to go conservative on this, and we would provide fine-tuned estimates once we actually got a better direction on this. But we estimate that in 2014 we generate $7.8 million in general fund dollars, and in 2015 we generate $10.7 million in general fund dollars. If you assume 5% inflation per year, then that goes up to $9.5 million and $13.6 million. Obviously, we'd work with the DOI to fine-tune those estimates and with the Department of Health and Human Services for the enrollment figures. So the idea behind this one is if we're generating extra general fund dollars, is there a potential for us to use some of that funding, at least in the first couple years when enrollment is difficult to quantify, say 25 or 50% of the general fund dollars, to be able to put that toward the expenses of the exchange and lower the per member per month fee by that amount.
Mr. Hager, Kevin Walters, for the record, the premium tax is assessed on what entities?
The premium tax is assessed on fully insured products. So on insurance carriers.
Thank you.
And then the final item is item number E, is to fund the exchange through a combination of methods described above. Obviously, the general fund, even if you took 100% of the increase, that would not cover the total costs of the exchange. However, it could take part of it, and so you need to consider potentially using a blend of these methods. I would ask the committee to keep in mind the key principles that have been approved by the board: stability, reliability, and predictability, encouraging participation, minimizing adverse market impacts, flexibility, sustainability options, routine monitoring, evaluation, and accountability, transparency, and protecting special populations. We discussed the legal issues at the last meeting. I briefly touched on them, so I think we're okay with that. So with that, it is staff's recommendation that we pursue option A and option D. That we fund the exchange through an assessment on enrollment within the exchange, and that we offset a portion of that through an appropriation from the general fund of approximately 25% of the estimated increase in premium tax due to enrollment in the exchange. With that, I'll be happy to take any questions.
So the combination, this is Kevin Walters, how much will come from A versus D?
So for the recommendation of using A as in alpha and and D as in delta, we have estimated that I should have closed this. For now, I'd feel comfortable for now using the 0% inflation, just because we don't really, we need to fine tune these numbers a bit. But we're estimating that if we use 25% at 0% inflation, that's in the last paragraph of item D, we would generate $1.9 million in 2014 and $2.7 million in 2015. That's 25% of the total amount. So that would offset item A. And so if you look on page 5, figure 4, you can see that $12.8 million is coming from exchange enrollment, $300,000 from supplemental revenues. If you reduce that by 1.9, almost $2 million, you're going to reduce the fee by about 1/6 or 1/5. So instead of $10 or $10.50, you're looking at closer to about $9 per member per month. And then, of course, we would adjust that so we meet the long-term amount. The recommendation is only to request the general fund assessment for the first 2 years, 2014 and 2015, for this next biennium only.
Thank you. if we were to have a shortfall in membership, it seems to me there are several options. I mean, one, you potentially would not reduce the rate to the members. I guess I'm asking, is that an option? Secondly, I assume we would have, since we're funding it by both A and D, we would potentially, where would it most likely come from? From not dropping the rates down to the members, or I guess we would, the general fund income would be set, would it not?
So, for the record, John Hager, so the general fund income to the exchange would be set during the budgetary process. The actual revenues that are received by the general fund are completely dependent on the enrollment in the exchange. So that would potentially be a concern to Director Mullenkamp in the budget office. So that's one of the reasons why we are requesting 25%, just to be safe. Say we're not, if enrollment is half of what we expect, we didn't take all of it. We're taking less than what we're going to get. But that would give the general fund some buffer. At least we are contributing to the general fund, not taking away from it. You had another question in the beginning. What was it?
So Kevin Walters, for the record. So to restate my question, if we did not get enough membership, what would be Plan B be to keep the exchange in the black?
So yes, if we didn't get enough enrollment, we would either have to cut expenses or we would have to request more funding from the legislature. If we are provided general fund dollars, theoretically we could go for a supplement or an appropriation from the IFC contingency fund. I don't know if that would work, but it's a potential. It is a concern.
Increase our advertising.
Would it also be an option to keep the per member rates flat or increase them?
Yes. So let me correct myself a little bit. So first of all, we will set the rates in advance of the plan year. If we end up with a shortfall situation, we can increase rates in future years. The difficulty may be that we may not know, by the time that we have to give our rates to the carriers, we may not know what our end enrollment is going to be. We may be able to get an idea depending on when we need to get that information to the carriers. But yes, we can adjust the rates. If we end up with excessive enrollment, I would think that we would decrease the rates so that we get to our long-term rate faster, and so that we don't have any more than a 30-day or somewhere around a 30-day reserve. So with an excessive amount of enrollment, we would actually charge lower rates in the next year. With too little enrollment, we'd have to charge higher rates in the next year to make that up. The issue would be, how do we get by in that specific year that we have that deficit situation? Now, we are allowed to request an advance from the general fund of 25% of the expected revenue for the fiscal year, and because the calendar year transfers over the fiscal year, we might be able to do some magic with that. But it would probably be, the biggest concern would be in that first 6 months.
Thank you.
This is Scott Dickinson. A question. Can you help me make sure that I understand, given that option D will require legislative action, when is it that we'll know whether or not that's a viable option? Or I guess, when will the exchange know, and when will carriers know whether that's a viable option or not?
In June of next year. That we won't know until June of next year for sure whether that's a viable option. We can get a sense from the policymakers early on whether or not it's a viable option. Based on the discussions that I've had so far, it appears that we can go forward with starting to talk about it. Because we are generating extra general fund dollars, there's more appetite for that than just asking for general fund dollars without giving anything.
Okay, thank you.
Hey, John, for the record, Eric Lloyd. In the board meeting last week, there seemed to be a lot of discussion and a prolonged, debate about whether or not this was going to be formulated as a business, as a market, or as a general good. And I think from the discussion we had on our last committee meeting, there was a sense that the majority of folks believed a public good was probably too far-fetched. But then the committee kind of rested on the exchange functioning as a market. And I guess, do we need to answer that fundamental question first before we go into these options? I mean, I know that the staff has laid out the recommendations of option A and D, but what seemed to catch or make the board a little uncomfortable was that we were deciding upon a direction of either a business or a market before we were making further recommendations. Does that need to be decided first before we make these recommendations here?
For the record, John Hager, I'm not sure that it does. Based on the extensive discussion at the last Finance Committee meeting and the board meeting, it appeared that nobody really wanted to make that decision without data. With the data, you can actually answer the actual question on which way you want to go with this. So my recommendation is to go forward with this based on the data that you see here, and whether or not you want to determine the philosophical question on who this assists. That's obviously up to the committee. I'm kind of baffled on how to proceed with this, as we've provided it both ways here, so it's up to the committee.
So is the suggestion,
Kevin Walters, for the record, is there as I understand that, John, you're saying we would proceed as recommended, and then we would come back and validate that decision based upon what the study found. This recommendation of A and B combined, does that assume a certain determination on that business value to entire market or public good?
The recommendation for item A is in alpha and D is in delta is based on discussion with certain policymakers and where it is likely that this will end up during the legislative session.
Now let me restate my question for the record, Kevin Walters. Does A and or D, does that require a determination of the impact of the exchange as either a business or of the A, B, C options, a business value to the entire market or public good? Are those contingent upon that final study having results that it is one or the other?
For the record, John Hager. So what we've tried to do in the data that was provided is show what the impact is to individuals outside of the exchange. So if we can go back to page 8 as an example, and this was where the item B, where we chose to, where the option is to charge the entire qualified health plan enrollment. If you look at the second light blue line that says non-exchange qualified health plan enrollment fees, so these are fees that are charged for enrollment outside the exchange. We're estimating that we would get $5.5 million from individuals outside of the exchange. Other than providing this kind of data, I'm not sure exactly what other impact analysis that we could provide, but I'm willing to take recommendations.
Mr. Trigger, for the record, Kevin Walters. I agree with the approach of waiting for the study. Sounds like we're going to have time to do that between now and next June, if I understood correctly. I think what I'm asking is just, and I don't think the question can be answered now. I'm just putting the question out there. Is there some way that we can have someone look into, correlating the funding options with, I'm looking at the item number 5, first page, where it says at the bottom, the board requests that the committee revisit the determination of exchange sustainability options of framing exchange A, B, or C, ending with S, a public good. Is there a correlation between the funding options of, I think, A through E with those A, B, and C options of framing the exchange? I'm not looking for an answer now, but I think it would just be helpful for me to understand how those relate.
For the record, John Hager, so option number A, or letter A, would correlate with the exchange as a business. Option numbers B and C would correlate with the exchange providing value to the entire market. And if you are accepting general fund dollars, that one you could say it's as a public good because you're getting tax dollars. However, in this particular case, because you are generating funds from the enrollment in the exchange, you could indicate that we are using this money to help stabilize or minimize the increase in cost in the first couple of years based on enrollment only in the exchange. So item D could really go kind of either way. So that's generally where those philosophies stand with each of these individual items. And obviously item E is a combination of the 2 or 3 philosophies. As far as doing any further impact analysis, I would need assistance or ideas from the committee on what kind of information the committee would like to have to better make a decision.
For the record, Kevin Walters, thank you. That's very helpful. I'd suggest that, your rationale on D being offsetting with the tax makes sense to me. My conclusion, therefore, would be that all we have to have is a determination that it should be framed as a business. Then that would justify the fee to the members, and we wouldn't need a study. Is that the right way to interpret that?
I would be happy to take a motion and a vote on that if the temporary chair would like that.
Well, I would need some help. So if you could restate that so we understand what what you're suggesting. I'm not sure I caught that.
Do you want to make a motion?
Yeah. Can you make the motion?
Yeah, I would move that. Well, I don't know if we need to make a motion. I don't know that we have to. We haven't already made a decision to have a study, have we?
For the record, John Hager, if the committee would like a study, I would request assistance on determining what the outcomes of that, what we're looking for the outcomes, what are the measurable quantities to provide the committee that would assist them in making the decision. As I indicate, go ahead.
For the record, Kevin Walters. So I don't feel like a recommendation is in order if we don't need the study.
So this is Scott Dickinson. Let me say this. When I'm prepared to support the recommendation that staff has made. I think it does a good job of balancing the funding needs and the uncertainties that we have today and the statutory authority that we have today. So I'd be prepared to support that without any further studies.
For the record, Kevin Walters, I would agree. I share your position.
Hey, John, for the record, Eric Lloyd. There are a couple public comments that would like to be voiced before we make a formal recommendation. Is that possible?
Yeah, can we ask for any public comments?
We have some. Down south.
Good afternoon. Can you hear me?
Yes.
Oh, great. For the record, my name is Babette Bond, and thanks for taking this. I know it's a little bit out of order, so I appreciate it, members of the committee. I would really like us to review a little bit about how the Affordable Care Act is putting the money together for the premiums that are going to be paid on the exchange before you decide who should be taxed for that. My name, I think I said, is Babette Bond, and I work for a large self-funded plan in town, and I also work with the Coalition of Self-Funded Plans. And Thursday's meeting of the board is the first time that we heard that there's a mechanism that might provide taxation on self-funded plans. And the reason that's of great concern to us is it became apparent after that meeting in discussions with some of the board members of the exchange that not everybody is aware of the status of self-funded plans. In the state of Nevada, as in every other state in the country, when the Affordable Care Act put these exchanges into place, they have blocked self-funded plans from participating in the exchange. So we don't have access to the exchange. And because we don't have access to be able to offer plans or our membership on the exchange, we don't have access to the subsidies that are going to be provided through the exchange. And in 2013, the subsidies that are going to come from the federal government to help pay for the insurance premiums on the exchange by the Congressional Budget Office are $17 billion nationally. In the next year, it's $35 billion, and the year after that, it's $58 billion. So billions and billions of dollars is going to come into insurance companies' hands directly through the federal government on the exchange. The exchange is a business. Exchange is not a public good. Exchange is a business. It's going to be a really profitable business for the commercial insurance industry. And the subsidy levels for those that are going to be subsidy eligible on the exchange are estimated to be about $5,000 for every subsidy eligible person. The subsidies range from 138 or 9% of the poverty level to a family income of 400% of the poverty level. That's an extensive income range, particularly in our state. So a lot of people are going to be eligible for subsidies in the state of Nevada. That being true, a lot of federal dollars are going to go into the exchanges, but only for plans that are on the exchange. And so those subsidies of billions and billions of dollars are what we very strongly believe should be paying for the cost of the exchange. The self-funded plans can't be there. We can't go in and get any of those subsidies. It's been completely created for the commercial market. So we're not state licensed, we're not allowed on the exchanges, we don't have access to the subsidies. So it's really not appropriate for self-funded plans to pay a taxation for an exchange they can never use. So we are going to very strongly oppose that, and we'll do that in the next public meeting, but we wanted you to be aware that there's a real difference between a self-funded plan and an insured plan that can go on the exchange. And we don't believe that we should be subsidizing the insurance companies that are already going to be subsidized by the federal government when we don't have access to any of that. We wanted to make sure you understand that piece before you decide to tax self-funded plans as part of something we don't have access to. One more person. Hopefully they're listening.
This is Jeff Ellis with Energy and Resorts. I want to echo what Babette said, but as listening to the conversation that just happened, let me reiterate what I just heard you say, which is on Plan A and D, on the outline that you put together, A is for basically taxing the insurance companies that are in the exchange on the enrollment that's in the exchange, and then D would be picking up a piece of the additional premium that fully insured plans pay to the state for their insurance premiums. I think it's the tax, and that's really all you're looking at is 25%. It's 25% of that. I believe if that is correct, and that's the way I understand it, and you're leaving the self-funded plans out of this altogether because we do not pay premium insurance. All you're going to do is pick up the additional enrollment that's going to be provided to the state on the premium tax that the fully insured products pay. Am I correct? Okay.
That's what I understand. And for the record, Eric Lloyd, the original fee that we were talking from a PPM, as I understood it, was for the qualified health plans. And then option D, so option A was for qualified QHPs. Right? So you have to be a qualified health plan, receiving enrollment. That's what the fee would be paid on the exchange. Option D was the currently uninsured and taking 25% of the premium tax that would then is not being currently captured. So they're capturing it now at a 25% ratio of that dollar amount.
Right, which is like 3.5 or 2.5, depending on whether you are in a home-based agency. But it's the fully insured products in the state that currently pay the insurance premium.
For the record, John Hager. For the record, John Hager, yes, the staff's recommendation was to go with item A as in alpha and D as in delta, to charge an assessment to the fully insured carriers for enrollment within the exchange, and to request from the legislature that they appropriate 25% of the estimated increase in general fund dollars. None of the options that we have in this report involves providing a tax or assessment, charging a tax or assessment to any self-funded plan. While it was on the agenda, it was not provided in the report, and that is not a recommendation.
Great. So let me just clarify, as long as I've got the mic for 1 second. On the agenda, on item 5, B1, all self-insured and self-funded plans, you're not putting self-funded plans into the pot with fully insured plans, and you know that there's a difference in how we're treated on the exchange. And this recommendation coming out of the Sustainability Committee will not be to tax self-funded plans, correct?
The recommendation from staff was to not tax self-funded plans. I cannot speak for the committee.
Okay.
And could we have the gentleman there re-say your name and spell your name for us for the record?
Oh, it's Jeff Ellis, E-L-L-I-S. I'm with MGM Resorts International.
Thank you.
Thank you. Do we have any other public comments in the south? Do we have any here in the north? None here in the north. Do we have any comments on the phone? Okay, so I think, this is Scott Dickinson, what I think I've heard is we're ready for a motion to accept the staff's recommendation to proceed with options A and D as proposed. So can we have...
For the record, this is Renee Niehaus. If we were to go, should part of that motion be if we were to go with A, or would it be a second motion on how we're, what am I trying to say here? If we go with option A, would we not have to determine if it's a fee charged to the carriers or a fee charged to consumers, or would that be a second motion?
That can be a second motion.
Should we have discussion about that before we make the motion to go with A, just in case there's an issue with one or two not working?
So this is Scott Dickinson. I'll ask a question first. Does the staff have a recommendation on that question as well?
Yes, if the committee were to choose staff recommendations for item A and item D at 25% of the increase in general fund dollars, staff would also recommend that the fee be charged to the carriers for several reasons, but the largest reason is, well, there's for two reasons. Number one is the administrative burden of collecting fees from the individuals, and number two is because they wouldn't be able to receive a subsidy on that fee.
And when you say, this is Renee again for the record, when you say wouldn't be able to receive a subsidy, can you just expand on that a little bit?
Yes, for the record, John Hager. So from my understanding is that the premium tax credit that's provided by the federal government is a percentage of the premium of the second lowest silver plan. If there is an amount that is assessed outside of that's not considered premium at that point, not a premium charged by the carriers, then you would not be able to collect, or the individual would have to pay 100% of that fee. If it's $10 or whatever, they couldn't get a subsidy for that piece of the assessment. If the assessment is charged to the carrier, it's considered part of the premium for the purposes of calculating the premium tax credit, and therefore you could get the extra subsidy dollars that the Affordable Care Act allows, the extra premium tax credit that the Affordable Care Act allows for those fees.
So the subsidy, this is Renee Niehaus for the record. So the subsidy for the carrier, for the premium, they would not be able to apply that to the second lowest plan.
If the fee is charged directly to the consumer, my understanding is that you cannot use that as part of the premium to calculate the premium tax credit. However, if you charge that to the carrier, it's an administrative expense of the carrier. It goes into the total premium calculation and can, in fact, be used to basically increase the amount of premium tax credit.
Okay. And this is Renee Niehaus for the record. Would that matter how that assessment is, applied to the member? Because you could either put it in the premium, or you could actually say there's an assessment fee right on the invoice. Would it matter?
So if we charge the carriers, they will figure out a way to get the money from the consumer.
Well, I would think that no matter who, if we fee charge to the carriers, whatever that fee is going to be, it's going to be in the premium.
If it's charged to the carriers,
either
yes.
That, or it's going to be a line item that just says this is your assessment fee for being in the exchange. Would it make a difference? So if you did a line item and it just said you have a $10, assessment fee, your premium is $400 and your assessment fee is $10, would that make a difference? Would it still be included in the premium and taxed?
I'm not sure. But if we charge an assessment to the carriers, they'll include it in the premium. How they want to show the costs of their plan is up to the carrier.
Okay, so it's really going to be initiated by the way the regulation is worded.
I suppose, yes.
On what they could do with that assessment fee from the state.
For the record, John Hager, I'm fairly confident that if we charge the carriers, it's considered, the carriers will consider it an administrative expense and charge it in the premium. Whether they break out whether they show the various expenses of their plans or not, I don't know. I don't know how they would do that, if they would do it, but because it's included in the premium, the individual would be able to have their premium reduced by the amount of the premium tax credit with that amount included in it. And I'm getting nods from the DOI.
John, for the record, Eric Lloyd. I guess maybe to answer Ms. Niehaus' question, we should consider one of the 8 key principles that we established early on, and that was to make sure that we're protecting the members from excessive user fees and harmful barriers to coverage. That might be viewed as one of those barriers, and so perhaps the fee on the carrier would be more appropriate, and let them decide how they're going to address it.
Absolutely, and if you consider, if it's charged to the consumer, let's pretend that the fee is $10 per member per month. If you charge it to the consumer, they're paying the premium to the carrier, and they're paying $10. If you include it as a fee to the carrier, while the premium goes up by $10, if they're getting subsidized 50%, the individual only pay $5 and the federal government will pay the other $5, whatever that percentage will be, but that's just an example. So that would certainly protect the consumer.
That was my point. Thank you.
Thank you.
So this is Scott Diggins, and let me propose wrapping this into, I think, one motion would be, so to adopt the staff's recommendation of option A and D, with option A being the fee being charged to the carriers.
For enrollment within the exchange
For
only.
enrollment within the exchange, which is what option A says,
Yes.
correct? Yes.
So Eric Lloyd, for the record, I don't, Mr. Dickinson, chairman, temporary chairman, okay, so it's Eric Lloyd. I would support that motion, but just with the understanding as outlined in item number A, that the concerns that were raised, are we suggesting then that we could include the NRS provisions that are in there that would prevent those issues that were addressed in item A, subsection 1? Is that your recommendation, John? Is that part of the staff's recommendation?
Actually, yes, that was part of it. It was part of staff's recommendation that I didn't say, so you read my mind.
Okay, thank you. As long as that's in, I could support item A and D.
Okay, so can we have somebody make a motion?
Can I propose a motion?
Yes.
For somebody to adopt? So the motion would be to move to accept staff's recommendation for item A and item D at the 25% level of the general fund, and to charge the fee to the carriers, and to submit a bill draft request to limit the tax liability of that additional fee to the carriers.
Motion to approve.
This is Scott.
I motioned the last one. I didn't want to steal anyone else's thunder, so.
This is Scott Dickinson. I'll second the motion.
You can't, you can't
Okay.
second because you're chair. Well, you can vote.
This is Kristen Royer. I'll second the motion.
Okay, all in favor say aye. Aye.
Aye.
Aye.
Any opposed?
Motion passes.
Okay. Thank you.
Eric Lloyd, for the record, well, just one more clarifying note. After sitting through that last board meeting and feeling the pain of the board, does this committee want to at least make a clear distinction of which path we're going at, defining this as a business or as a market? I mean, is that necessary? Because I think that was what was catching up the board a little bit, and they weren't able to move forward. We actually made a recommendation. This committee made a recommendation, and then the board said, well, we don't really like that recommendation. Give us another one. So, are we going to go back with the same recommendation? I mean, I know we offered options A and D, which were a mix. So, I just want to make sure that we're all clear and unified as a committee back to the board, so that we can support our position.
For the record, John Hager, while there were members of the board that were opposed to the position of the committee, I think most of the concern was the fact that much of the same concern that was provided by this committee was that staff was asking you to provide a philosophy on where you were going without the appropriate data. I think you have the appropriate data here, or I think, well, you've made a motion, so I would assume that you've got the appropriate data at this point. I think that the board would accept that now that the data is there. Whether or not you want to continue with the motion to indicate that the exchange is operating as a business, that couldn't hurt.
Yeah,
This is Kevin Walters, for the record. I'll make the motion that we frame it as a business.
Do we have a second?
Eric Lloyd, for the record, second.
Okay, all in favor say aye.
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 Any opposed? Hearing none opposed, the motion passes.
Thank you.
So are there any other, this is Scott Dickinson, any other comments on agenda item 5 before we move on? Okay, so moving on to agenda item 6, discussion and possible action regarding possible statutory and regulatory changes required to implement the financing options for the exchange.
For the record, John Hager, so we don't have a written report for this. We are going to submit at the bill draft request by June 1st the language that the committee just approved, as far as the concept that the committee just approved. Because we don't have another board meeting before then, we'll bring that to the board for their approval. If they don't approve it, we can strike it from our BDR, but we'll go forward that direction. As far as regulatory wording to impose the fee, we'll need to bring that back at probably the next meeting or possibly a meeting after that. We're just starting to get into the creation of the regulations. We haven't really, we've kind of got this, staff has kind of started thinking about it, but we don't really have anything on paper yet. So we're going to start doing that, and we will bring that back to a future meeting. So if there's any questions.
Okay, any questions?
No questions. No questions down south, since it's only me.
Okay. Moving on to agenda item 7, discussion of future meeting agendas.
For the record, John Hager, the next Finance and Sustainability Committee is scheduled for June 19th. That's a Tuesday at 9:30 a.m. And I'm not sure if that's at the Legislative Building or where, but you'll get the agenda when we have it ready for you. So again, that's Tuesday, June 19th at 9:30 a.m. As far as other items, obviously we're going to include the regulatory language if we have it by then. We'll provide an update to what we provided for the statute. And I think that's it.
Okay. Do we have any more public comment?
No public comment down south.
Okay, do we have any here in the north? Any public comment on the phone? Okay, hearing no public comment. We're adjourned.
Thank you.
Yeah, that's what we were going back and forth about. Yeah, that's what
I think we heard last meeting we did need a motion.
Yeah, no, we do need a motion. Can you about that? Because those emails will have to get back and forth and keep trying to.
There's so many people on the
Wow,
phone.
there's a lot of people on the phone.
There was only 3 people that ever said their name.
I know.
Because we didn't
Workers.
have lots of other agendas were approved without the process action, so we said
no problem.
Just adjourn.
It's not how I run
said
meetings.
just because somebody one of the chairs said motion, we said, oh no, we can't do that. So I thought he said but you don't have to do it when it is, right?
I'm glad we got this done. I think we were overcomplicating it quite a lot.
Well, it was simply it's from moving on
So that's fine. But
policymakers.
I think what he was saying was, put the 4 possible motions.
Well, yeah, I think that there's some practical realities.
So you could just go ahead and adjourn.
Even the 25%, I mean, that's just what's going to be average discussions behind it.
Okay, so okay, good. All right.
I won't say that I'm optimistic.
Yeah, he could have this time, not the last time.
I think
Since an action
it's not
item.
an
Oh, yeah, oh, yeah, that's right. So, yeah, so he could have.
He could have, but he didn't
Yeah,
have to.
he didn't have to.
Good. All right.
Okay, we're good.
Thank you.
No problem.
Appreciate it.
So, future meetings, I'll be
Are
on
we
the phone.
legally adjourned?
Yeah. Can we really leave the room?
No, well, you
Yeah, yeah,
guys,
yeah.
I'll be out of state.
Yeah.
For future meetings.
Yeah.
So, I will, in fact, I don't think I've provided you contact information for that.
Oh, yeah.
So, yeah, you guys have it.
And you know what, in our email system,